All right, let's get right into it. We're talking about one of the biggest, most radical shifts happening in medicine today, the rise of the AI doctor. We're going to break down the incredible promise, the really serious perils, and what it all means for you and your health. So let's start with a huge question. Could an algorithm actually save your life? And believe me, this is not science fiction anymore. It's the central question we're tackling today. AI is already involved in life or death decisions, but to really get where this is all going, we first got to look at why it's even happening right now. The reality is our healthcare systems are stretched to the breaking point. This quote here really gets at a problem we're seeing everywhere. Wait times are way too long, and our doctors and nurses are just completely burned out from all the administrative work. That kind of pressure, well, it forces you to look for new solutions. And right now, a lot of people are looking at AI. So, what are we even talking about when we say AI and healthcare? Put simply, it's about computer programs that can do things that used to require a human brain. Making predictions, helping with decisions. Now, this isn't about replacing doctors, not at all. It's about giving them a powerful new tool, like an analytical superpower. Okay, so let's start with the good stuff, the promise. And honestly, it is pretty remarkable. AI is handing us a brand new toolkit that could help us fix some of the most stubborn problems in medicine. First up, something that sounds small but is actually huge, tackling the paperwork nightmare. So many doctors spend a crazy amount of their day just typing up notes. But now you have these AI scribes that can just listen to a conversation and create all the clinical notes automatically. This frees up the doctor to, actually look at their patient, to listen, and to connect. And the results, they're staggering. In some studies, these AI tools cut down that admin time by nearly 70%. For a doctor in a normal clinic, that can mean getting back 3 whole hours every single week. And that's not just a number on a chart. That's more time for empathy, for thinking through a problem, for all the human stuff no algorithm can do. So from freeing up time, we move to, enhancing sight. Think of AI as a super-powered magnifying glass for doctors. It can scan thousands of medical images, CT scans, X-rays, you name it, and find these tiny, subtle patterns that are pretty much invisible to the human eye. And what does that mean? It means we could catch diseases like cancer way, way earlier than we do now. Get this. There is a model that can look at CT scans of a head injury and predict whether the patient will need emergency brain surgery with over 80% accuracy. In a situation where every single second is critical, that kind of instant, superhuman insight can literally be the difference between life and death. And AI isn't just finding diseases, it's helping us treat them in totally new ways. We're seeing AI-powered chatbots that offer mental health support anytime, day or night. And there are incredible tools that can analyze your unique genetic code to figure out the absolute best drug for you. This is medicine tailored not just to the illness, but to the individual. And it's not just about today's doctors. The next generation is getting a serious upgrade too. AI can create these unbelievably realistic virtual patients for medical students to practice on. They can try complex procedures in a totally safe environment. Plus, it can scan and summarize all the latest medical research in seconds, so doctors always have the newest information right there. And finally, AI is helping to move healthcare out of the clinic and into our own homes. Your smartwatch, your smart ring, all these things are collecting data. AI can analyze that constant stream of information, spot the early warning signs of a problem, like with your heart, and flag it for a doctor long before it ever becomes a crisis. 68%. Just let that sink in. That is how much one program in Canada cut down on emergency room visits for people with chronic conditions just by using AI-powered remote monitoring. That is a massive win, right? Patients are safer and more comfortable at home, and our overcrowded hospitals get some much-needed breathing room. Okay. The potential is obviously enormous. But with this kind of power comes some really serious risks that we absolutely have to face head on. So now we need to look at the other side of the coin, the peril. This is the question that changes the entire conversation. See, an AI isn't some perfectly objective machine. It learns from the data we feed it. And if that data is full of our own human biases and inequalities, well, the AI doesn't just learn those biases. Sometimes it makes them even worse. Experts have flagged 5 big issues we need to keep a close eye on. But for now, we're going to zoom in on 3 of the most urgent ones because they get to the very heart of trust in medicine. Biased data, who's responsible when things go wrong, and, of course, our privacy. So you really have to understand this term, algorithmic bias.
It's what happens when the data we use to teach an AI is skewed. If you train a system mostly on data from one group of people, it might make really bad or even dangerous decisions for anyone else. You've heard the saying, garbage in, garbage out. It's that, but with potentially life-threatening consequences.
And look, this is not a what-if scenario. It is already happening, and it's causing real harm. We know that pulse oximeters, those little things they clip on your finger, are less accurate on people with darker skin. And AI can inherit that bias. We've seen algorithms recommend less care for Black patients because they were trained on flawed historical data. And if an AI only learns what a typical heart attack looks like from male patients, it can completely miss the different symptoms women often experience. This all leads to something called the black box problem. Some of these AIs are so complicated that even the people who built them can't tell you exactly how they made a specific decision. So what happens when that AI makes a fatal mistake? Who's to blame? The programmer who wrote the code? The hospital that bought the software? The doctor who trusted the recommendation? Right now, the law has no clear answer, and that is a very dangerous place to be. And let's not forget, all of this is built on our data. Our most private, sensitive, personal health information. For these AI systems to get smart, they need to analyze millions and millions of our records. And if that makes you feel a little uneasy, you are not alone. A recent survey found that nearly 80% of doctors themselves aren't confident about what all this means for patient confidentiality. With stakes this high, you can bet the race is on to build some guardrails, the rules, the regulations, the ethical guidelines we need to make sure these incredibly powerful tools are used safely and for the good of everyone. And this isn't the Wild West. Regulators are trying to catch up. You can see here how the U.S. Food and Drug Administration, the FDA, is slowly but surely building a real framework. They're moving from just talking about the problem to creating actual concrete rules for how to manage these devices from the moment they're created to the moment they're retired. Beyond government rules, experts are also trying to create a code of ethics. Take a look at this framework. Number 1 is huge. A human expert must have the final say, no exceptions. Number 3, transparency directly attacks that black box problem. And maybe most important is number 6, equity. AI has to be trained on diverse data so it works for everybody. You can think of this as trying to write a Hippocratic oath for the digital age. So here we are at this massive crossroads. On one hand, we have this incredible technology that has the potential to heal millions, helping a system that is crying out for a lifeline. But on the other hand, we've got a tool that can absorb and even amplify our worst biases, raising all these tough questions about safety and who's responsible. And that really brings us to the final, critical thought to lead you with. The AI doctor is here, and it's learning every single day from every piece of data it sees. The question for all of us is, who gets to write its moral code? Because at the end of the day, it's going to be up to everyone, the tech developers, the doctors, the regulators, and us, the patients, to make sure that this powerful new creation learns to heal everyone, safely and fairly.